pump a pace of 100 beats per minute.
Oh, okay, that's hard to keep track. How many is that per hour?
How's that going to help you?
I will divide and then count to it.
Okay, well, a good trick is to pump to the tune of Staying Alive by the Bee Gees. Do you know that song?
Yes, yes, I do. I love that song. First I was afraid, I was petrified.
No, it's staying alive, staying alive.
You were in the parking lot earlier, that's how I knew you. Staying alive, staying alive. Staying alive, staying alive.
You can't tell by the way I use a woman's man no time to talk. Since I was born, it's alright, it's okay. You can't look the other way. You don't know, I don't know.
Staying alive, staying alive.
Okay, you didn't maintain 100 beats per minute, and the ambulance didn't arrive because nobody called 911, so you lost him.
Okay, he's dead. Anyone know what we do next? Anybody? Rose?
I have no idea.
Anyone else?
We bury him.
Wrong. And check for an organ donor card. If he has one, we only have minutes to harvest.
He has no wallet, I checked. He is an organ donor.
He is. Give me some ice in a styrofoam bucket. Here we go. We search for the organs. Where's the heart? Precious heart.
I'm not feeling well. I need to sit down.
Shout to the first place. Are you okay?
All right, so unfortunately, that's going to be the most excitement and the most laughing that you're going to have all class. But we'll try to make it interesting for you guys and teach you guys actually a valuable skill here. So the situation that I like to use is the cardiac arrest that we were on. It was, I remember it pretty vividly. It was a Sunday morning. Normally the way the firehouse works is on weekends, we do our things, we get all of our work done, and then basically after our work is done, we're done for the day. So we just finished up breakfast. It was about 11:30, 11:45, and the tones went off for an unconscious, unresponsive male. It was right when COVID started, so we were very protective with the amount of gear that we were putting on. We were putting on essentially full hazmat suits to go into situations like this because there's so many what ifs and so many unknowns at that point. So it was the station over on Rollin Road, and we were going to the general vicinity of Plum Grove and Euclid. So we're about 2 to 3 minutes away. So the way it works at the fire department is someone calls 911, the dispatcher starts asking questions, they go through a basis of what they need to get. Another partner starts talking, starts sending us information. So the tones go out with the information that they have so far. They keep on asking more questions, and they get us en route. So from the time the tones go out to the time we're en route, it's about 1 minute and 30 seconds. On average, we're expected to be out the door moving in about 90 seconds. It's a little easier during the day, it's a little more difficult at nighttime when you're sleeping in the tones roll. So it took us about 1 minute and 30 seconds to get out the door, get on the road. We had about another 1 minute and 30 seconds to drive to that particular location. So we're already probably at about 4.5 minutes that the patient had been down. Of course, it's in a condo, so of course he's on the second floor. So we get upstairs, our lieutenant for the day ran upstairs to see what the situation was going on and start compressions as quickly as possible. Dispatchers in this area are great because they are CPR trained. So they, in a situation like this, it's great that you guys are getting the CPR certification, but if you guys actually need to do it, it's like all the training goes out the window. So they are doing a great job of coaching people through the situation and coaching them to what you need to do as far as compressions, breaths. If you don't feel comfortable doing breaths, compressions only CPR is better than nothing. So we got upstairs to the second floor. The wife
was extremely agitated. I started asking her questions. We realized that we were working a cardiac arrest. He was in the front room of the condo. She was in one of the back bedrooms and just heard him collapse. So it was as close as you possibly could to be a witness to cardiac arrest. So we started running through our SOPs. We were doing compressions. We put the pads on the patient. We shocked him twice while still doing compressions. And the second shock that we had an organized rhythm. So of course, unfortunately, this gentleman was probably close to 350 pounds. Up on the second floor, it's very difficult to package a patient and get them down the stairs in apartment buildings and condo buildings with everything going on like that. But we managed to package him up. We managed to get him downstairs into the ambulance. By the time that we had him in the ambulance, he started fighting with us. By the time that we got him to the hospital, we had a full set of vitals. As we were pulling into the hospital campus, he started arguing with us. Started saying, just let me go, I want to go home. Didn't have any recollection of the situation. I basically told him that he was dead. I told him you were in cardiac arrest and you were essentially dead, sir. He didn't believe us. We got him into the emergency room. The nursing staff at the hospital ended up having to sedate him because he was so agitated after the situation. He came back to the firehouse 6 weeks later, down 60 pounds, being extremely apologetic. He did not remember the situation. He did not remember the cardiac arrest. He drew a blank from the time that he hit the floor all the way until after he came out of the sedation from the ER staff. So didn't remember anything, was very appreciative, didn't have any deficits. That's the biggest thing, is early CPR has the best chance of having no deficits. Because the reason that people have deficits after if CPR actually in fact works and you're able to bring them back, is because you're circulating oxygenated blood through the body. It's going through and doing the whole entire loop. They're finding out more and more that they're taking pulse checks out because there's people that are spending way too much time trying to find a pulse. And as long as you're doing compressions, you're off of the body and it takes that much more time. It's essentially trying to get the engine going again. Once you're off of them and you're not doing compressions, everything is stopped. If you try to find a pulse or doing other things, that's downtime, and it takes you that much longer to get the pump going again. It would be great if you would watch a TV show and they're shocking every single person. That doesn't happen. The majority of patients are in a rhythm that's not shockable. So the best thing that you could do to possibly save a person is CPR. The shock will be the thing that will get the heart back into an organized rhythm, but it's actually the compressions that keep the people alive and keep them in a state that they might actually have a good life after suffering a cardiac arrest. Okay, any questions up until then? All right, so we will get going with the DVD.
It was really my shift at the cafe around 8:45 on Monday morning, and I was still feeling tired and groggy. A customer ran up to the counter and asked, "Does anyone know CPR?" The man had collapsed outside on the patio. Suddenly, I was wide awake. I didn't have formal training in cardiopulmonary resuscitation, that's CPR, but I had learned some skills from the American Heart Association website and from scouting when I was a kid. At first, I was nervous, but there was no time to waste. Somebody needed help now. Outside, the adrenaline kicked in like a shot of espresso, and I knew exactly what to do. The customer had collapsed in a patio chair. I'll never forget his face. It was pale as a piece of paper. He wasn't breathing, moving, or responding. While someone called 911, I lowered the man to the patio. I remember thinking, I have someone in my arms who is dying, so I started CPR. I put both hands on the center of his chest and just started pushing hard and fast. I kept doing chest compressions and breaths for about 2 minutes until medical help arrived. After medical help took over, I washed up, had my apron on, and went back to surgery and coffee. But for the rest of my shift, I wondered how I was doing. Later, I found out he was a 66-year-old man named Mike. He survived his cardiac arrest and is doing well. I also found out that most people who witness a cardiac arrest either don't know CPR or are afraid to do it. So, they call 911 and they wait. Medical help gets there as fast as they can. But in the United States, it still takes an average of 4 to 10 minutes for them to reach someone with cardiac arrest. That means receiving CPR from a bystander gives a person's best chance to survive until medical help arrives. It also means any CPR is better than no CPR. My career goal is to be in law enforcement and to do search and rescue. But you don't have to be a medical professional to save a life. By learning hands-on CPR, you too can be ready to help someone in cardiac arrest. It might even be a friend or a family member whose life is in your hands. On your next coffee break, why not take the time to learn hands-on CPR?
What would you do if someone collapsed suddenly in front of you? Although Kurt stepped up and helped someone he didn't know, you are much more likely to be in a position to save the life of someone you know and love, like a parent, child, spouse, or friend. Today, you'll learn the skills to help respond in an emergency, but that's only half the battle. What would you do if you were standing in that line for coffee? Would you have the confidence to act? Cardiac arrest can occur without warning, or within just a few minutes after symptoms appear, and it can occur in both men and women. However, recent studies have shown that in the United States, women are less likely than men to survive cardiac arrest, as are underrepresented groups such as Black and Latinx communities when compared with their white counterparts. So it's important to remember that cardiac arrest knows no gender, race, or ethnicity. And in a cardiac emergency, everyone needs CPR to survive. Welcome to Heart Saver CPR and AED, presented by the American Heart Association. An emergency can happen anywhere at any time, and this course will help prepare you for the types of emergencies you might encounter. For information on additional topics not covered in this course, please consult your student workbook. Today, you'll learn CPR, how to use an AED, and other life-saving skills. To help you along the way, your student workbook covers all the material and includes quick reference guides. We recommend you put these guides in your first aid kit for easy access during an emergency. If you complete all the course requirements and demonstrate the skills directly, you'll receive a course completion card. Keep in mind, though, that studies show you should frequently review the course information and practice the skills to maintain your ability to respond to cardiac arrest. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. But when and how do you provide CPR? Has the person had a heart attack or cardiac arrest, and what's the difference? Cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver, so it can no longer pump blood to brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing or is easily gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when the blood flow to part of the heart muscle is blocked by a clot in a blood vessel. If the blood vessel is not reopened quickly, the heart muscle normally nourished by the vessel begins to die. Heart attack symptoms may include discomfort, pain in the chest, or an uncomfortable feeling in one of the arms, the neck, the jaw, or the upper back. Other signs of heart attack are shortness of breath, breaking out in sweat, nausea, or lightheadedness. For both women and men, the most common heart attack symptom is chest pain or discomfort. However, women are less likely to seek treatment for a heart attack. This may be because they're somewhat more likely than men to experience some of the other common symptoms of a heart attack. These symptoms include shortness of breath, nausea, vomiting, and back or jaw pain, which they often mistake as symptoms of acid reflux, flu, or normal aging. A heart attack can lead to cardiac arrest. A person in cardiac arrest needs CPR to survive. CPR stands for cardiopulmonary resuscitation and consists of two parts, chest compressions and breaths. When CPR is needed, chest compressions should help blood get to the brain and other vital organs. It's natural to hesitate or to question yourself when faced with an emergency. There are many myths about performing CPR. Myth number 1, true or false? Many Americans are prepared to act in an emergency. False. Most Americans feel helpless to act because they don't know how to perform CPR or are afraid of hurting the person. Unfortunately, less than half the people who need CPR get the immediate help they need before advanced help arrives. Myth number 2, you can hurt someone by giving CPR. Even if someone doesn't need CPR, you're unlikely to hurt someone by providing it. Although it's possible for a person to receive injuries like a broken rib, these injuries are minor compared to death. Survival rates drop by as much as 10% from every.
So a quick note on that, as far as you're not going to hurt anyone. When you are doing CPR, imagine a guy my size doing CPR on a 90-year-old woman. All of those ribs are going to break right off of the sternum. So for the first 5 or 6 compressions, you are going to hear all of those ribs breaking off the sternum. It's a sound that hopefully you'll never hear, but it's like one of the creepiest sounds in the world. It's like cracking your knuckles times 10. So it's just an eerie sound. It does go away, but that's a good way that you know that you're doing effective CPR is when you're getting down the full 2 inches, because a little later in the video, it'll go over how deep you're supposed to go. But that's how you know that you're getting down deep enough, is actually hearing that. And it doesn't happen on all patients. The younger they are, the less likely it is to happen, but it does happen on patients.
Not receive CPR. Doing something to help someone is better than doing nothing. Myth number 3, you can be sued for performing CPR. All 50 states have good Samaritan laws in place to protect people who try to help save a life. For more information on good Samaritan laws in your state, check the state government's website. Myth number 4, true or false? AEDs should be used only by healthcare professionals. False. AED stands for Automated External Defibrillator. AEDs are safe and easy to use by anyone. We'll discuss AEDs in more detail later. For now, all you need to know is that to operate one, you simply turn it on and follow the prompts. An AED will only provide a shock if the person needs it. When we go about our everyday lives and something like this happens right in front of us, it may take a few seconds to realize that this is actually an emergency. When we do realize the urgency, there are steps to follow to determine whether a person needs CPR. First, before you start providing CPR, you need to make sure the scene is safe. Look for anything nearby that might hurt you. You can't help if you get hurt too. Next, check to see if the person is responsive. Kneel at their side, tap them and shout,
Are you okay? Are you okay?
If the person is unresponsive, shout for help. Someone who is responsive moves, speaks, blinks, or otherwise reacts when you tap them and ask if they're okay. Someone who does not move, speak, blink, or otherwise react is unresponsive. Here's a demonstration. While leaning over the person who's down, check to see if the person is responsive. Tap your shoulders and ask,
Are you okay? Are you okay?
if the person does not move, speak, blink, or otherwise react, then they are unresponsive. Shout for help.
Help, I need help.
If someone is nearby and can help, have that person phone 911 and get an AED. Say to them, you, call 911 and get an AED. If no one comes or you're alone, then phone 911 yourself and put your phone on speaker mode so that you can use your hands while accessing the person. You'll also need to get the AED yourself. If you're alone and don't have a cell phone, leave the person while you go to phone 911 and get an AED. Quickly return and continue providing emergency care. If you don't know where the AED is, or if there isn't one available, do not delay the start of CPR. Stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. The dispatcher will ask you about the emergency, where you are, and what has happened. In general, dispatchers can provide instructions that will help you. The dispatcher will also tell you how to help the person until someone with more advanced training arrives and takes over. The dispatcher will be able to tell you how to do CPR, use an AED, or give first aid. In an emergency, the sooner you realize that there's a problem and get help, the better it is to the ill or injured person. The next step in assessing the need for CPR is to check your breathing. When the person is unresponsive, scan the chest for 5 seconds, but no more than 10 seconds. Check your breathing. If the person is not breathing normally or is only gasping, they need CPR. If a person is gasping, it usually looks like they're drawing air in very quickly. They may open their mouth and move their jaw, head, or neck. You might hear a word called agony gasps in the first minutes after cardiac arrest. These gasps may appear forceful and weak, and sometimes they pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. Gasping is not regular or normal breathing. It's a sign of cardiac arrest of someone who is unresponsive. Let's look at these steps all together in assessing the need for CPR. Before you provide CPR, check to make sure the scene is safe. Tap and shout to see if the person is responsive.
Are you okay? Are you okay?
If the person is unresponsive, shout for help.
Help, I need help.
Do you know what
If
your
someone
overtime
comes,
rate is?
have that person phone
Can you
911
find out?
and
Do you have
get
ESS? Find out for me and let me know.
Okay. If no one comes to help and you have a cell phone 911 and put it on speaker mode so you can hear the dispatcher's instructions. You will also need to get the AED yourself. If you're alone and don't have a cell phone, leave the person while you go to phone 911 and get an AED. Quickly return and continue providing emergency care. If you don't know where the AED is, or if there isn't one available, do not delay the start of CPR. Next, scan the chest for 5 to 10 seconds, check your breathing. If the person is not breathing normally or is only gasping, you need to begin CPR immediately. If the person is breathing normally and is unresponsive, place the person on their side until someone with more advanced training arrives. The video will now pause while you get in position practicing safety and assessment.
Does anyone have any questions on that? All right, so what we're gonna do is we'll build all of this in at the end. So not having you guys, we're gonna do compressions multiple times, but not having you guys get up and do practice scene safety. We'll build that in towards the end of this module, okay?
Now, let's talk about chest compressions and hands-only CPR. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR, if they see a teen or an adult collapse. There are two simple steps to follow. Phone 911 and push hard and fast in the center of the chest. High-quality CPR requires two main skills, providing compressions and deep breaths. Compressions are the most important part of CPR. We'll go over compressions first, and then we'll talk about breaths. A chest compression is the act of pushing on the chest. When you push down directly on the chest, you pump blood to the brain and other organs. To perform high-quality compression, you need to do four things. Provide compressions that are deep enough. Provide compressions that are fast enough. Allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. We're going to demonstrate chest compressions and then give you a chance to practice. When providing compressions, you're acting like the heart because in a cardiac arrest, it's not beating directly on its own. By providing compressions, you're pumping blood to the brain and other vital organs, keeping them alive until advanced help arrives and the heart can begin beating on its own. You need to push hard to a depth of at least 2 inches or 5 centimeters and push fast at a rate of 100 to 120 compressions per minute. Let's watch this demonstration. Then you'll get to practice. To provide chest compressions, first move the person to a firm, flat surface. Quickly move bulky clothes out of the way. If the person's clothes are difficult to remove, you can still provide compressions over their clothing. If an AED becomes available, remove all clothes that cover your chest. AED pads must not be placed over any clothing. It may seem awkward or uncomfortable removing someone's clothing, especially if you don't know them. But it's a necessary step to make sure the AED pads make direct contact with the skin. Remember, good Samaritan laws protect people acting in good faith. So fear legal repercussions should be a reason to not provide CPR. Place the heel of one hand in the center of the chest over the lower half of the breastbone, and put the other hand on top of the first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended. If you're using a feedback device, your instructor will explain how your device works. When you reach the correct depth, you might hear a click or see a green light, depending on the mannequin you're using. In a real emergency, there won't be any feedback, and you'll have to estimate at least 2 inches or 5 centimeters. You should push hard and fast, at a rate of 100 to 120 compressions per minute. Studies have shown that you're more likely to perform CPR at the correct rate if you're thinking about a song you know with the beat between 100 and 120 per minute. The Bee Gees song, Staying Alive, has a great name and is the correct rate for performing chest compressions. The American Heart Association website provides titles of additional songs that can help you give compressions at the correct rate. Finally, you need to allow the chest to come all the way back up after each compression. This is called recoil, and it's an important step that allows the heart to refill with blood. Our aim is to minimize interruptions in chest compressions to 10 seconds or less. This is true in all situations for everyone, including pregnant women. Do not delay providing chest compressions for pregnant women in cardiac arrest. Provide high-quality CPR just as you would for any other adult. High-quality CPR can increase the mother's and the infant's chance of survival. The video will now pause while you get in position to practice chest compressions.
Okay, so since we only have enough mannequins for each table, we're going to do this twice. So one person, go ahead and stand up and get the mannequin in front of you. Those face shields don't have to be out right now. It's good that we're a few people short here. So I'm going to demonstrate. Can everyone see me up here clearly? What you're ideally going to want to do is lock your arms out. I know we're up on a table. If you would be doing this, you'd probably be doing this on the floor, but I can't expect everyone to stay kneeling for the next 2.5 hours. I wouldn't want to do it, so I can't expect you to want to do it. Okay, so ideally you're going to have this patient on the floor. One of the biggest things is making sure that if you find a patient that's unresponsive and needs CPR, pulling them off of a bed. I've run into numerous situations, even at nursing homes, where there's people that are doing compressions on beds. Can anyone give me a reason why that wouldn't be good? You're sinking in. You're not doing any effective CPR because you are just pressing that bed down and you're not getting the pump to work and get going here. So ideally, locking out those arms, hovering over the patient. I'm probably going to be sweating on the patient, but that's going to be the least of their worries right now. So you're going to be locking those out and you're going to be doing compression, okay? We're going to walk through it here. If there's another person on scene, the best thing that they could possibly do is, everyone's got a smartphone now, go to YouTube and type in CPR metronome at 110. We have metronomes on our monitors. We do compressions a lot more than a layperson does. We still go too fast. So once that metronome gets turned on our cardiac monitor, it's like, oh boy, we are going way too fast. We gotta slow down because your adrenaline's going, the situation at hand's going. So just if there's another person on scene, have them actually pull up YouTube and type in CPR metronome 110. And that will get you the perfect rhythm to do CPR. Are you doing the class too, sir? You wouldn't mind coming up here? All right, so what this is going to do, there's going to be no breaths. It's just going to be doing chest compressions. So it'll count you down, and then you guys will start.
To provide chest compressions, place the heel of one hand in the center of the chest over the lower half of the breastbone, and put the other hand on top first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended. You should push hard and fast, at a rate of 100 to 120 compressions per minute. Finally, you need to allow the chest to come all the way back up after each compression.
I know it's up on a table, so you can lock out those arms. And then a little slower. Absolutely. If you feel... Okay. Go ahead and switch compressors.
Chest compressions. Place the heel of one hand in the center of the chest, over the lower half of the breastbone, and put the other hand on top first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended. You should push
one per person.
hard and fast, at a rate of 100 to 120 compressions.
Everyone should have them pretty close.
Finally, you need to allow the chest to come all the way back up after each compression.
All right, go ahead and have a seat. Pretty tiring. Imagine doing that for 45 minutes. That's about the average cardiac arrest that we run. We do have new technology, which is great, as far as a Lucas device, which does perfect chest compressions for us, but it's limited too. Also, let me see if I could actually pull it up here really quick. One second here. So this is the Lucas device that we have. It does perfect compressions, and it doesn't get tired, and it does it at the perfect rate too. So actually right here, this is like the main part of it. Right here, it's a piston-driven device. So it comes down, and then it starts automatically. There are some limitations as far as if a patient is, their torso is too big, or children. So we're still not going to lose our job over this, thank goodness, but it does work out great for us. And it has limited, prior to COVID, on average, we would get 8 to 9 people on a call. That got shrunken down quite a bit during COVID. We were running basically down to about 6. And the Lucas device was in play, but it wasn't as prevalent beforehand. And now that we have one for each station, we don't necessarily send that support rig. So when we're toned out to a cardiac arrest, it's the battalion chief, an ambulance, which has 2 guys on it, and then either the truck or the engine that has 3 guys on it. So all of us have specific spots that we are working in that situation. Does everyone have a barrier device?
No.
Okay, let's get those situated and handed out to make sure everyone has it. If you don't have one, please raise your hand. Okay, perfect. All right, everyone else has got one? Okay, so go ahead and open those up. Those are your gift from the Rolling Meadows Fire Department. These are also good things that you could buy at Walgreens. And you could just throw it in your purse and not have to worry about it.
The second skill providing high-quality CPR, giving breaths. Breaths are especially important for infants, children, and anyone in cardiac arrest due to choking, drowning, drug overdose, or any other respiratory cause. It's a common misconception that humans exhale only carbon dioxide, when in fact, we exhale a number of compounds, including oxygen. This means that the oxygen in your exhaled breaths is helpful to a person who can't breathe on their own. Before giving breaths, open the person's airway. Opening the airway correctly will help keep the tongue out of the way to make sure your breaths are effective. As you practice this skill today, you'll be using a mannequin. It's important to note that in this upcoming demonstration, you'll see breaths given without a face shield or pocket mask. We'll cover giving breaths with a pocket mask in our next section. But for this practice session, your instructor will provide a face shield and mannequin sanitizing wipes. Face shields are relatively inexpensive barrier devices that are a great addition to any first aid kit. Watch this demonstration and then you'll get a chance to practice. Remember, you don't want to interrupt compressions for more than 10 seconds to give breaths. To open the airway, follow these steps. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. This simple action lifts the tongue away from the back of the throat, opening the airway. It's important to avoid pressing into the soft area under the chin because this might block the airway. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if you give someone a breath and the chest doesn't rise, allow the head to go back to its normal position. Then, open the airway again by tilting the head back and lifting the chin. Give another breath. making sure the chest rises. Don't interrupt compressions for more than 10 seconds to give 2 breaths. The video will now pause while you get in position to practice giving breaths.
So go ahead and put those face shields on the patient.
To open the airway, follow these steps. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise.
You're not going to see any chest rise on these mannequins. And if you do, let me know what you're doing here. Okay, off to the other person, if you would, please. Just switch.
To open the airway, follow these steps. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise.
All right, go ahead and have a seat. This next component, we'll just watch this. I don't have enough pocket masks to go around.
You may give breaths with or without a face shield.
A lot of the times, this is just a larger barrier device that has a one-way valve on it, so it protects you in case the patient vomits or anything like that while you're giving mouth-to-mouth. A lot of the times, I'm not sure about your AED. This is the new AED that you guys have. We'll go over it in a few minutes here. A lot of the times AEDs actually have like a side pocket that'll have these pocket masks on it, and all you do is literally just pop it open, throw the one-way valve, it might even be connected already depending on how they packaged it and store it. If not, you just put that one-way valve in there and then you just do the exact same thing as you just did for the barrier device. It's in a side pocket. There's also things that go on the AED as far as scissors, razors, depending on how many pads you have in there. So we'll just go ahead and watch this and then we'll move on to the next part.
If you're in the workplace, your employer may provide this kind of personal protective equipment for use during CPR. Many first aid kits also contain these supplies. There are different kinds of face shields and pocket masks, and there are different sizes for adults, children, and infants. So make sure you're using the right size. Pocket masks and face shields are made of plastic and fit over the person's mouth or mouth and nose. Face shields are a thin piece of flexible plastic meant to be a one-time use barrier between you and a mannequin or you and another person. Make sure that the face shield is pulled securely over the mouth and deliver breaths just as you would from mouth to mouth. Pocket masks are reusable barrier devices that can be sanitized between use. They're typically made of hard plastic with a one-way valve, and they protect the respirator from coming in contact with blood, vomit, and contagious disease. The one-way valve is the part you breathe into. A pocket mask may not be included in a typical first aid kit, but the AHA recommends that you add it. You may need to put a pocket mask together before you use it, but this is usually as simple as popping it into shape and connecting the 2 pieces. And by the way, use the one-way valve you were given for today's practice only, and then discard it. So, let's take a look at how to give breaths with a mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterward, we'll give you a chance to practice giving breaths with the mask. Start out kneeling next to the mannequin. Put the mask over the mannequin's mouth and nose. If the mask has a narrow or pointed end, Put that part of the mask on the bridge of the nose, and the wide part of the mask should cover the mannequin's mouth. Tilt the head back and lift the chin while pressing the mask against the mannequin's face. It's important to make a good seal between the mannequin's face and the mask while you lift the chin to keep the airway open. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if you give a breath and the chest doesn't rise, you need to reopen the airway and reposition the mask to get a better seal. Give another breath and make sure the chest rises this time, interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and fast on the chest again. Now we're going to practice using the mask to give breaths. The video will pause so you can put your mask together and get into place.
Does anyone have any questions on that? Okay.
By now, you've learned how to provide compressions and give breaths with and without a mask. Let's look more closely at using an AED. An AED is a device that can deliver a shock to the heart of a person in cardiac arrest if needed. Even though you may be in the midst of providing CPR, once the AED arrives, use it immediately. CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. During cardiac arrest, the heart quivers and stops pumping blood. An AED shocks the heart so that the heart's rhythm can reset and the heart can pump blood again. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you'll hear prompts telling you everything you need to do. AEDs may have 2 sets of pads, a large set to use for adults and a small set to use for children. Make sure you use the large pads on anyone 8 years of age or older. Later, we'll talk about using the smaller pads for children younger than 8 years old. You may have already moved some of the person's clothes out of the way to perform CPR, but you should remove all clothes that cover the chest before using an AED. AED pads must not be placed over any clothing. It's important that the AED pads not touch anything other than the person's bare skin. Peel away the backing from the pads and attach them to the person. Follow the pictures on the pads. You don't need to remove a person's jewelry as long as it doesn't interfere with the placement of the pads and isn't in contact with the pads. It doesn't cause a shock hazard to either the person being helped or the rescuer. However, undergarments should be removed, along with other clothes covering the chest, since they often interfere with proper pad placement. Plug the pad's connector into the AED and follow the AED prompts. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. If the AED recommends a shock, it will tell you to stay clear or not touch the person. If the AED tells you not to touch the person, look to be sure that no one is touching the person, including you, and state something like, "Stay clear," or "Stand back," just before you push the shock button. As soon as the AED gives the shock, immediately resume chest compressions. After this demonstration, you will have a chance to practice using an AED trainer so that you can see what it's like. You will need to consider a few special situations when using an AED. First, if the person has hair on their chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has 2 sets of large pads, you can try this. Apply 1 set to the hairy chest, and if the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then, reapply a new set of pads to the bare skin. Water on a person's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the person's heart. If someone is lying in water, you should quickly move them to a dry area. However, if the person is lying in snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump, smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, don't place the pad directly over a medicine patch. If a medicine patch is located where you need to place the pad, take the patch off and quickly wipe the chest before you put on the pad. If you're not wearing gloves, make sure you don't touch the underside of the patch. You don't want to get any of the medicine on your bare skin. Use an AED for a pregnant woman in cardiac arrest, just as you would for any other person. If your workplace has an AED, you should familiarize yourself with it. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items can also be found in a separate emergency or first aid kit. The video will now pause to allow your instructor to lead a practice session with an AED trainer. These trainers simulate what a real AED would do, but they won't provide a shock.
What can we actually get better than actually having your real AED that you guys are going to see on a regular basis? Okay, so this is what the library has here. I know you guys just purchased it. Probably the most important thing is the tag right here. Call 911. Get us going early. We have no problem turning back around if it's absolutely nothing. But make sure that you are calling 911 as early as possible, because like we talked about earlier, it takes some time to get en route, okay? So these are, all AEDs are pretty close to similar. Some of them have their different nuances, but this is the one that you guys have, and this is a very good one, okay? So what it's gonna do is gonna point down there.
Adult mode. Remove all clothing from patient's chest. Pull red handle to reveal pads. Look at pictures on pads. Apply pads to bare skin exactly as shown in the pictures. Press pads firmly. Pull red handle.
So that's as far as it's going to let me go. I don't think you guys want me to pull the red handle and actually take the pads out. But this is a great one because it has one set of pads, and it has an adult mode and it has an infant mode. So at the top here is the infant mode. So all you do is press that button and it will deliver the proper shock. Hopefully you will never, ever, ever have to use this, but it's a great option to have. So basically what you're doing is you're going to be grabbing the AED, you're going to be putting a pad up here and a pad down here. You know, like they talked about, if there's medicine patches, you're going to want to take that off, wipe it down. In a situation like this, right now, this is, you have it probably mounted. I think I was talking to Kristen, it was towards the front door. Where was the end? Does anyone know where the end result was, where it was located? Front door. Okay, so left of the front door. So where someone always has eyes on it, because that is a big thing too, is making sure that these don't just walk off and disappear, because they are not cheap by any means. But just putting them here and here, and you're getting that direct current to go through the heart, because this is what essentially is going to get the heart back into a rhythm, a viable rhythm. Question?
Does it matter what side? To the heart?
It does matter what side, ideally, you know, if it doesn't work out, but ideally you're going to be going high on the right and low on the left. And the pads, I don't have another set of pads here, but the pads do show that exactly where you're supposed to place it. So follow the prompts, follow that through, and it won't steer you wrong. Sure.
The difference between the adult and the, you call them infant, but what age group is that?
Great question.
that will get it on the next portion. We have the adult portion of CPR, and then we are going to briefly go over the child portion, and then we'll go over to the infant portion. So it'll answer that shortly. Yes?
And where does the pad placement go if there's a pacemaker?
As close as possible.
Just like under,
As close as possible to where where you could get that line and get the current through.
Now we're going to demonstrate how to put it all together.
So after you guys are done watching this, this is what you're essentially going to do, is put it all together. We're going to run through a scenario where you'll verbalize scene safety, and you'll just basically verbalize what this portion of the DVD is, and that will be your test, okay? And you'll be doing the compressions.
Teaching an assessment, to providing compressions and giving breaths, to using an AED. Afterward, you'll get a chance to practice. First, check to make sure the scene is safe. Tap and shout to see if the person is responsive. If the person is unresponsive, shout for help. Ask someone to phone 911 and get an AED.
Phone 911 and get an AED.
Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, provide CPR. Make sure the person is lying on their back on a firm, flat surface. Quickly move bulky clothes out of the way. If a person's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Now, tilt the head back and lift the chin to open the airway. Give 2 breaths. Remember, do not interrupt compressions for more than 10 seconds. Give another set of 30 chest compressions. Now, tilt the head back and lift the chin. Give 2 breaths. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid. Attach the pads to the person's bare chest. Follow the AED prompts and the pictures on the package or pads. Plug in the pads connector. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. Press the shock button if the AED says to, and immediately resume CPR, starting with compressions. Now the video will pause and your instructor will help you practice putting it all together.
Any questions on that? All right, so go ahead. First person, go ahead and stand up. You're going to be verbalizing scene safety, BSI. You are going to be verbalizing someone call 911, get the AED, and then you're going to be checking for responsiveness. Ideally, 5 seconds just to make sure, seeing if they're responsiveness. And if they aren't, that's when you're going to start compressions, okay? So we're going to do those verbalizing those steps, and then we're going to do 5 sets of 30 to 2 compressions. So you're going to start with doing 30 compressions, 2 breaths, 5 times. And when you're done with that, just go ahead and have a seat, okay? So whenever you guys are ready, just go ahead and begin. What? I've only heard staying alive. Mm-hmm. And when you're done, just go ahead and have a seat.
Actually, you know what? When you guys are done, go ahead and rotate them over to the other person. And just when you guys are ready to go, just go ahead and start. So we can get you guys going out of here a little quicker.
That's okay. Are you okay? Yeah. Yeah, I didn't have any AED. I did ask if you were okay.
When do you have your specialist appointment? Did you guys have it already? Yeah. Yeah. Gotcha. But everything looked okay from yesterday?
Yeah, it's like
Threshold?
yeah, it's like right at the
Where's your wife delivering at? Is that her choice? My first son was born in Northwest. I lived here. It just, you know what, you gotta do what's comfortable for you. But my wife went, our first son was born in Northwest. There was a lot of complications. She ended up having a C-section, which she shouldn't have had. And then my wife got a doula, which is like a birthing assistant. And she, we were going to go to Lutheran General. And the doula's like, yeah, Lutheran General, you know, like asking her situation. How'd that feel for everyone? Hiring? Yeah. The hardest part is just trying to make sure that you're doing effective and good compressions, okay? But nice job, everyone.
Now that you've had a chance to practice compressions, you can see that providing CPR requires a lot of effort. It can be tiring to keep up the pace. Therefore, if someone else at the scene knows CPR, take turns providing CPR by switching at least every 2 minutes, even if you're not tired. As you help each other and take turns providing CPR, it's important to give each other feedback. While you're resting, remind the other rescuer to push down at least 2 inches or 5 centimeters at a rate of 100 to 120 compressions per minute, and to let the chest come back up to its normal position after each compression. You've just practiced life-saving CPR and AED use for adults. The video will now pause for your instructor to test you on these skills. Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. We've all been in this situation where food or drink gets caught in our throat, making it difficult to swallow or even breathe for a few seconds. These situations are called mild airway blocks and are normally relieved without intervention. If a block is mild, a person can make sounds and cough loudly. When this happens, you may want to help, but it's best to stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, then the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding their throat. If this happens, you need to act right away to try to clear the airway. To help in this situation, you will give abdominal thrusts slightly above the navel. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might have a severe airway block, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that they are choking and can't talk, you need to act. You'll need to give thrusts slightly above the navel. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around their waist with your fists encurved. Make sure to position yourself so that you are stable in case the person collapses to you.
And do you guys notice anything here of how the guy's positioning himself behind? Absolutely. So that leg right there is huge because if the person becomes unresponsive, all of that weight is going to be coming back down on you. So making sure that you have your leg in between the person and your arms wrapped around the person, that'll prevent you from getting hurt also.
People find it helpful to stand with their feet shoulder width apart and one leg slightly forward. This creates more stability. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak. An adult who has been given thrusts should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the person is pregnant or very large, you will need to change how you relieve choking. Put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrusts instead of abdominal thrusts. You can also use this technique for someone in a wheelchair. If you give someone thrusts but cannot remove the object blocking the airway, the person will become unresponsive. In this case, we need to give CPR, but there are a few differences. First, you'll need to get the person safely onto a firm, flat surface. This can be challenging, especially if the person is much larger than you. The best technique is to slowly walk backwards and allow the person to slide toward the floor until they're flat on their back. As you've already learned, when a person becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED if they haven't already. Put the phone on speaker mode so that you can talk to the dispatcher. Provide CPR, starting with compressions. After 30 compressions, you will do something a little different from what you were taught earlier. Open the airway and quickly look in the mouth. If you see an object in the mouth, take it out. Do not attempt to reach in and pull anything out that you can't clearly see. This is known as a blind finger sweep. Doing a blind finger sweep may cause the object to become lodged farther back in the airway. Remember, you want to minimize interruptions in compressions to no more than 10 seconds. After checking the mouth, give 2 breaths. Keep repeating the sets of 30 compressions and 2 breaths. Each time you open the airway to give breaths, look for the object in the back of the throat if you haven't already found it. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.
Any questions on that?
Yeah, one.
Sure.
So for the choking person that you've had to resort to this CPR approach, the first time there's no breaths, but then after the next cycle there are?
Yes, after you're looking to see if there's something that you can get possibly out of the airway.
Okay. And if you see nothing, you're still going to do breaths on the next cycle?
Yes, because you could possibly push that off to somewhere where they could start breathing again. Does anyone need a break? You guys doing okay? Okay. So if it's okay with you guys, we're gonna do the child and the infant. The child CPR is essentially the same thing. You're not doing anything different on children than you are on adults. So if you guys are okay with it, we'll do the intro part and just go over the little nuances and little differences. And then we'll go on to the infant. There's no difference in compressions or breathing. It's just a few things here. So if you guys are okay with that, we will do that.
Welcome to the Child CPR and AED section for this course. For the purpose of giving CPR, a child is anyone from 1 year of age to puberty. Puberty is defined as chest or underarm hair on boys and any breast development on girls. If you're unsure of a child's age, treat them as an adult. Children usually have healthy hearts. Cardiac arrest in children often results from breathing problems, but it can also be caused by drowning, severe injury, poisoning, and other problems that reduce oxygen delivery to the body. For this reason, it's very important to give compressions and breaths when giving CPR to a child. Many of the steps you learned in adult CPR will be the same in child CPR. Make sure the scene is safe. Tap and shout. Shout for help. Send someone to phone 911 and get an AED, or phone 911 yourself and put the phone on speaker mode. Check for breathing, and begin sets of 30 compressions and 2 breaths. As you just learned for adult CPR, you need to make sure the child is on a firm, flat surface, like the floor, before you start CPR. You need to push fast at a rate of 100 to 120 compressions per minute, and let the chest come back up completely after each compression. When giving compressions to a child during CPR, you need to push the child's chest down approximately 2 inches or 5 centimeters. For a child, you can use 1 or 2 hands to give compressions, whichever is necessary for you to adequately push the child's chest down approximately 2 inches, 5 centimeters. If you're alone and don't have a cell phone, it's important to start CPR for children as quickly as possible. In this situation, wait to phone 911 until you have provided 5 sets of 30 compressions and 2 breaths. When you help children, it's especially important that you don't delay the start of CPR. Then, after 5 sets of compressions and breaths, leave the child to phone 911 and get an AED if one is available, before resuming CPR as quickly as you can. Remember to stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. Let's watch the steps all together in assessing whether a child needs CPR. Because the main difference between adult and child CPR is what you do if you're alone and don't have a cell phone on you. Let's imagine we're in that situation. First, check to make sure the scene is safe. Tap and shout to see if the child is responsive. If they're unresponsive, shout for help. Unfortunately, no one seems to be nearby. If you have your cell phone with you, you could phone 911 and put it on speaker mode. But regrettably, the phone isn't nearby either. In this situation, it's important to continue the steps of assessing the need for CPR and wait to phone 911. Scan the chest for 5 to 10 seconds. If the child is not breathing or is only gasping, provide CPR. Make sure the child is lying on their back on a firm, flat surface. Quickly move bulky clothes out of the way. If a child's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. After 5 sets of 30 compressions and 2 breaths, if no one has come to help, leave to phone 911 and get an AED if one is nearby. You've learned how to assess the need for CPR and phone 911. Now let's focus on compressions and how they should be done. Chest compressions for a child are not that different from compressions for adults. You need to push hard and fast in the center of the chest. When providing compressions to a child, start by using one hand for compressions. If you can't push down approximately 2 inches, which is 5 centimeters, with one hand, use 2 hands to compress the chest. Sometimes people don't push hard enough during child CPR because they don't want to hurt the child. However, it's better to push too hard than not hard enough. Let's watch this demonstration. You need to push hard and fast in the center of the chest, approximately 2 inches or 5 centimeters, at a rate of 100 to 120 compressions per minute. It's helpful to keep your elbows slowly extended. Finally, you need to allow the chest to come all the way back up after each compression. Now that we've reminded you how to give chest compressions, it's time to add the next important skill in providing high-quality CPR, giving breaths. As with chest compressions, giving breaths to a child is very similar to giving breaths to an adult. One difference to consider is that for small children, you won't need to blow as much air in each breath as you would for larger children or adults. Also, if you're using a pocket mask to give breaths to a child, make sure to use a child-sized mask if available. This will help ensure a proper seal, resulting in effective breaths. Let's watch this demonstration. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then tilt the head back and lift the chin. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise.
Any questions on that child portion there? All right, so go ahead and get the adult mannequins out of the way. This is where the fun part and the infant part comes in. Giving you guys all fair warning right now, the infant heads are going to roll. It happens every single time. It's like a little bowling ball, okay? So I don't want you guys to be like, oh my gosh, no. It happens. It's just a matter of who's the lucky person to have it happen to first.
Welcome to the infant CPR portion of the American Heart Association's Heart Saver CPR AED course. For the purposes of this course, an infant is anyone younger than 1 year of age. Just as in adults and older children, when an infant's heart stops beating, blood stops flowing to the body. Because infants are so small, you'll perform CPR differently on them than you would on children or adults. When providing compressions to an infant, you use just 2 fingers of one hand, or the 2 thumb encircling hands technique, instead of using 1 or 2 hands as you would for children, and 2 hands as you would for adults. If you can't achieve the appropriate depth, you can use the heel of one hand, just as you learned in CPR for children. Another difference in infant CPR is that you should push down approximately 1.5 inches, which is 4 centimeters, at the rate of 100 to 120 compressions per minute. This is the same rate that you already learned for adult and child CPR.
All the bags.
When dealing with an unresponsive infant, it can sometimes be hard to be certain if the infant needs CPR. If the infant is not responsive and isn't breathing or is only gasping, start CPR. It's better to give CPR to an infant who doesn't need it than not to give it to an infant who does.
And then we'll tie in.
CPR is not likely to cause harm if the infant is not in cardiac arrest. But without CPR, an infant who is in cardiac arrest may die. Here are the steps in assessing whether an infant needs CPR. First, make sure the scene is safe. Look for anything nearby that might hurt you or the infant. Check if the infant is responsive. Tap their foot and shout their name. If they don't move, make a sound, blink, or otherwise react, they're unresponsive. Shout for help. If someone comes, have that person phone 911 and get an AED. If no one has come and you're alone and have a cell phone 911 and put it on speaker mode. Listen to the dispatcher's instructions. Next, check the infant's breathing by scanning the chest for 5 to 10 seconds. If the infant is not breathing or is only gasping, provide CPR. Make sure the infant is lying face up on a firm, flat surface. Quickly move bulky clothes out of the way. If an infant's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Give sets of 30 compressions and 2 breaths. If you don't have a cell phone and the infant is not injured, after 5 sets of 30 compressions and 2 breaths, you may carry the infant with you to phone 911. Keep giving sets of 30 compressions and 2 breaths until someone with advanced training arrives and takes over. To provide high-quality compressions, you do 4 things. Provide compressions that are deep enough. Provide compressions that are fast enough. Allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. When providing high-quality compressions, pushing hard and fast is just as important in infants as it is in children and adults. Make sure the infant is lying on their back on a firm, flat surface. Some people find it easier to use a raised surface. Quickly move bulky clothes out of the way. If an infant's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Remember, one of the main differences in infant CPR is that you use just 2 fingers or 2 thumbs to provide compressions. Watch this placement if you're using 2 fingers on the infant's chest. Put 2 fingers of one hand on the breastbone, just below the nipple line. Press the infant's chest straight down approximately 1.5 inches, which is 4 centimeters. After each compression, let the chest come back up to its normal position. You'll need to give compressions at a rate of 100 to 120 compressions per minute. Watch this demonstration for placement if you're using the 2-thumb encircling hands technique on the infant's chest. Encircle both hands around the infant's chest, placing the thumbs on the breastbone, just below the nipple line. Press the infant's chest straight down approximately 1.5 inches, which is 4 centimeters. Remember, if you can't achieve the appropriate depth, you can use the heel of one hand just like you learned in CPR for children. Now, the video will pause while you get into position to practice providing chest compressions to an infant.
Any questions? So you guys could probably stay sitting for this portion of actually doing compressions on the infant.
Put 2 fingers of one hand on the breastbone, just below the nipple line. Press the infant's chest straight down approximately 1.5 inches, which is 4 centimeters. After each compression, let the chest come back up to its normal position. You'll need to give compressions at a rate of 100 to 120 compressions per minute.
All right, so go ahead and switch it over to the other person at your table. Do it one more time.
Put 2 fingers of one hand on the breastbone, just below the nipple line. Press the infant's chest straight down approximately 1.5 inches, which is 4 centimeters. After each compression, let the chest come back up to its normal position. You'll need to give compressions at a rate of 100 to 120 compressions per minute.
Definitely a lot easier than on an adult mannequin, but still tiring and nerve-wracking.
As with children, when an infant's heart stops beating, it's usually because they can't breathe or have trouble breathing. Therefore, it's important to give breaths as well as compressions to an infant doing CPR. When you give a breath, opening the airway correctly will help keep an infant's tongue out of the way. Opening the infant's airway too far can actually close the infant's airway, making it difficult to get air inside. Follow the techniques you're about to learn to make sure you open the infant's airway correctly. So, let's look the steps for opening the airway and giving breaths to an infant. And remember, this should be done quickly during CPR, never interrupting chest compressions for more than 10 seconds. We'll show you how first, and then you'll get a chance to practice. To open the airway, follow these steps. Tilt the infant's head by pushing back on the forehead and put the fingers of your other hand on the chin. It's important to avoid pressing into the soft part under the chin because this might block the airway. Also, don't push the head back too far. This might close the airway as well. The infant's head should be in a neutral position. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second for each. As you give each breath, you should look down at the infant's chest to see it rise. Infants don't need as much air as adults or even children to make the chest rise. But you'll only know the infant has gotten enough air if you do see the chest rise. Let's watch one more time. If you have difficulty making an effective seal, try either mouth-to-mouth or mouth-to-nose breaths. If you use the mouth-to-mouth technique, pinch the infant's nose closed. If you use the mouth-to-nose technique, close the mouth. Sometimes you'll find that your breaths aren't making the infant's chest rise. If you give a breath and the chest doesn't rise, quickly reopen the airway by allowing the head to go back to the normal position and then open the airway again. Give another breath and make sure the chest rises this time. Interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, resume compressions.
So it's going to have you practice while watching now, giving breaths, mouth to mouth. So those barrier devices I gave you earlier, get those back out.
To open the airway, follow these steps. Tilt the infant's head by pushing back on the forehead and put the fingers of your other hand on the chin. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second for each. As you give each breath, you should look down at the infant's chest to see it rise.
All right, go ahead and rotate that off to the other person. Play it one more time.
To open the airway, follow these steps. Tilt the infant's head by pushing back on the forehead and put the fingers of your other hand on the chin. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second for each. As you give each breath, you should look down at the infant's chest to see it rise.
Any questions? All right, so we're gonna, just like with the adult, we will just watch using a pocket mask to giving breaths to the infant.
You may give breaths with or without a pocket mask. If you work at a place that cares for infants, your employer may provide personal protective equipment, including pocket masks, for use during CPR. Infant masks and face shields function in the same way as those made for adults and children. It's important that you use a barrier device that's the correct size for the infant. So let's take a look at how to give breaths with the mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterwards, we'll give you a chance to practice. We'll start next to the infant. Put the mask over the infant's mouth and nose. If the mask has a narrow, pointed end, place that on the bridge of the infant's nose. The wide part of the mask should cover the infant's mouth. Tilt the head and lift the chin while pressing the mask against the infant's face. It's important to make a good seal between the face and the mask while you lift the chin to keep the airway open. Make sure to keep the infant's head and neck in a neutral position. Don't tilt the head too far back or you risk blocking the airway. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if the chest doesn't rise after you give a breath, tilt the head back and lift the chin and try again. You should try to give 2 effective breaths within 10 seconds. Now we're going to practice. The video will pause so that you can put your mask together and get into place. Now we're going to demonstrate how to put everything you've learned for infant CPR together from the beginning. From seeing safety and assessment to providing compressions and giving breaths. Afterward, you'll get a chance to practice. First, check to make sure the scene is safe. Tap the infant's foot and shout to see if the infant is responsive.
You okay? Are you okay?
If the infant is unresponsive, shout for help.
Help! Help!
If help is nearby, have someone phone 911 and get an AED.
Phone 911 and get an AED.
Check for breathing for at least 5 seconds, but no more than 10 seconds. If the infant isn't breathing or is only gasping, provide CPR. Make sure the infant is lying face up on a firm, flat surface. Quickly move bulky clothes out of the way. If an infant's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Give 30 chest compressions. Now, place the mask, open the airway, and give 2 breaths. Watch for the chest to rise. The video will now pause while you get in place to practice.
Alrighty, any questions? Alright, so you're gonna do the exact same thing as you did with an adult. You're just gonna do it on the infant as far as compressions, scene safety, BSI, activating 911, and someone else get the AED. So whenever you guys are ready, just go ahead and start. And then when you're done, rotate through to the other person at your table. We're doing that 5 times, 30 to 2, okay? So whenever you guys are ready, go ahead and begin. You haven't filled, did they show you how to fill these out in class? Okay, we'll go out. We'll do it in the afternoon. Okay. Just a matter of time. And the fun hasn't even begun with a child choking. Very true. Yep. Alrighty, everyone's done with that? All right, so I got a question for you for some of the people that have been here for a while. What was a better view, the townhouses or the bowling alley? Bowling alley. You could see more. It's definitely more condensed. And there's some of you who are like, wow, there was a bowling alley there? So yes, there was a bowling alley there, and there was it was in bad shape. That bowling alley was in bad shape, unfortunately. So, and then there's some of you, how many people have lived in Rolling Meadows for a while? 30 plus years? So you remember when Town Square wasn't here, when it was the old Dominic's? Yeah. The old Dominic's. Yeah. Yeah, so I grew up in the area. I went to Rolling Meadows High School. So like looking out here and seeing these townhouses, I'm like, wow, this place has definitely changed. Alrighty, so choking in infants. That's where the heads get rolling here, okay?
Choking is also a common emergency of infants. When an infant has severe choking, you need to act quickly. You'll use a combination of back slaps and chest thrusts to help remove the object blocking the airway. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. If a chair is available, you may want to sit and use your lap to support your arms. Even small infants can sometimes feel heavy, and it's very important to keep the infant's head down vertically to allow gravity to help dislodge the object. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto their back while supporting their head. Give up to 5 chest thrusts by using 2 fingers of your other hand to push on the chest in the same place you push during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until they become unresponsive. Give only back slaps and chest thrusts to an infant. Giving thrusts to the abdomen of an infant could cause serious harm. As with adults and children, never perform a blind finger sweep. Reach into the infant's mouth to pull out an object only when you can see it. Any infant who has been given back slaps and chest thrusts should be seen by a healthcare provider as soon as possible. The video will now pause for you to get in position to practice back slaps and chest thrusts on an infant.
Alrighty. So the biggest thing here is gravity. You're wanting to use gravity to your advantage. So essentially you're going to be holding the infant down like this. If you're able to, there's some infants that are very big. If you're able to, and you're going to be doing a forceful motion, but using gravity to try and push that object out, okay? So I'm going to get the video going here and just follow along with the video.
Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto their back while supporting their head. Give up to 5 chest thrusts by using 2 fingers of your other hand to push on the chest in the same place you push during CPR.
Don't even worry about the head.
Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until they become unresponsive.
All right, go ahead and rotate the headless infant over to the other person.
Hold the infant face down on your forearm.
Don't even worry about it. Just put it right back there. We'll take care of it later for the next class.
Between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto their back while supporting their head. Give up to 5 chest thrusts by using 2 fingers of your other hand to push on the chest in the same place you push during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until they become unresponsive.
Any questions on that? A plus if you somehow manage to keep the infant's head on.
During the process of giving back slaps and chest thrusts, if the infant becomes unresponsive, do the following. Place the infant face up onto a firm, flat surface and then shout for help. If someone comes to help, have that person phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide chest compressions in the same place as you would for CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Each time you give breaths, first check the mouth for an object and remove it if you see it. Repeat giving sets of 30 compressions and 2 breaths. Exactly as you just learned, after 5 sets of 30 compressions and 2 breaths, if no one has come to help and you don't have a cell phone, then take the infant with you and phone 911 and get an AED. Use the AED as soon as it's available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the object comes out, the infant starts to respond, or someone with advanced training arrives and takes over.
Any questions on that?
This wraps up our Heart Saver CPR AED course. By taking this course and stepping up to help when someone needs CPR or choking relief, you are increasing that person's chance of survival. The knowledge you gain today can help you change or even save someone's life. If you practice your skills often to keep them up to date, you'll have the best chance to help someone who may need immediate assistance when an emergency occurs. Your student workbook is a great resource, so use it to review this information between training courses. At the American Heart Association, we remain committed to exceptional training. Go to heart.org/CPR for more information on our courses and to learn more about our mission. On behalf of the American Heart Association, we congratulate you and thank you for taking the time to attend this important course.
All right, so that is CPR. Does anyone have any questions? Go ahead.
It said for adults, if you check their breathing and they are breathing, to put them on their side and wait for more advanced. Is that the same for infants and children as well?
Yes and no.
Okay.
With adults, you're worried about them vomiting and aspirating. With infants and children, they're smaller, so they're easier to move. An infant probably is not going to stay on its side. Ideally, you're just wanting to make sure that if they are vomiting, you're able to move it so that they don't aspirate from that vomit. Okay? Anything else? Good question. Yes?
There is like a few slight differences between adult and child for CPR. Anything for choking, or exactly the same?
Exactly the same. If you guys want, we could go over. Why don't I do that? Why don't I pull up here really quick? We can go over the child portion. It's a good thing to have. Let me pull that up.
As you learn with adults, choking in children is often caused by food blocking the airway. The block of the airway may be mild or severe. If it's mild, the child can make sounds and cough loudly. If this happens, stand close by the child and let the child cough. If you are worried about the child's breathing, phone 911. The steps for helping a child with a severe airway block is the same as for adults, with one exception. If the child is smaller, you may have to kneel to get into the correct position. If the child is too large for you to wrap your arms around the waist, put your arms under the child's armpits and your hands on the center of the child's chest. Pull straight back to give thrusts on the chest instead of the abdomen. You can also use this technique for a child in a wheelchair. A child who has choked and been given abdominal or chest thrusts should see a healthcare provider as soon as possible. If you give a child thrusts but cannot remove the object blocking the airway, the child will become unresponsive. When a child with severe airway block becomes unresponsive, you'll want to respond the same way as with an adult. Shout for help. Phone or have someone else phone 911 and begin compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out and give 2 breaths, but do not perform a blind finger sweep. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you don't have a cell phone, leave the child to phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the child starts to respond or until someone with advanced training arrives and takes over.
Alrighty. So thank you for actually bringing that up about child choking. What is the thing that kids choke on the most? The number one thing? No, not gum. Not popcorn. Hot dogs. Hot dogs. And then grapes. And then, it's funny that you guys, I'm thinking that Kristen probably put it together, but the lifesavers in the room, you know why the holes are in there? So you could breathe through. So that is with Cheerios also. So the hard candy, when you have like solid hard candy like the spearmint stars, it's like a perfect size along with hot dogs. So the reason the parents and the grandparents in the room, the reason you cut those up in quarters is to make sure that they don't choke on them. So I never realized with Cheerios or Lifesavers until I asked that same question about a year ago, and someone in the room said that. I'm like, wow, that actually makes sense. Makes a lot of sense. So I'm going, can someone grab Kristen for me? I was gonna be like, if she just came walking in that room, that'd be pretty amazing if that was the case. Just gonna check with her to make sure that she didn't want to go over the first aid that oh, there she is. No, definitely not. We are done with CPR. Do you want to go over the first aid box that you have?
It's on the wall.
It's on the wall, okay. Can it come off of the wall? Let's go take, yeah, I'm gonna go look really quick.
Plus, I want to show you something else. Could you do it with you?
Yes. Okay. It's not gonna be open, so I don't want to open it because I don't have another tag for it. Is it gonna stay in here? Let's go. Oh, this is. I wouldn't say it's a goodie bag because hopefully you will never, ever, ever have to use this. But these were introduced, these are Stop the Bleed kits. So unfortunately, these were introduced essentially within the last 5 years because of the mass shootings that are taking place. Here, basically, I shouldn't say just in Rolling Meadows here, but basically the northwest suburbs have been very proactive with active shooter situations. We have trained on it probably the last 6 or 7 years. We, in the fire department,
we have ballistic vests on our engines and helmets. So it's a cop-driven event. And for the people that are coming back Friday, Officer Bowden will go over it much more in depth with you because that's his specialty. But these are Stop the Bleed kits. So these are bleeding control kits that are used by individuals that are trained to the point of basically putting tourniquets on people and getting them out of the way. So in a situation, if they're, the only one that I could recollect a little bit was the situation a few years back at Woodfield, where the individual drove into Sears. That was toned out as a possible, I think, active shooter. I know we went to Schaumburg Station because they didn't essentially know what was going on. But Brett will go over the Stop the Bleed kit with you more in depth on Friday, give you an overview on it. These are all secured with tags on it, so I don't want to rip the tag off to show you the stuff because I don't know if there's a log with these tags. And if there is a log with these tags, someone would be like to me, well, why did you not relog it? So basically, this is all stuff for active shooter. This is the worst of the worst right here, okay? This is the much better stuff to go over with. These are the normal cuts. You guys have some good gloves in here. Alcohol swabs. I'm thinking that this is a few cold packs. Some lifesavers to go over that. Band-Aids, antibiotic ointment, and then just a few other different sizes of flexible Band-Aid, and some napkins. So basically, this is just to get, if someone comes up and asks you for a Band-Aid. If there's any kind of true medical emergency, call us. That's what we are here for. That's what we are going to respond. We were a lot closer to you guys a few years back. But now that we moved stations, we're still not far away. And we normally get here about 2 to 3 minutes. So give us a call. We'll be here as quickly as possible. The biggest thing to find out is just if you think someone's having a medical emergency, call sooner rather than later. Because time's of the essence there, and the sooner you can get us here, the better it'll be. We have no problem coming and determining that it's not a medical emergency. We just turn around and go back to the station. But it's always better to have us here quicker rather than later. Okay? Any questions? All righty. Well, thank you very much, guys. Thank you for your time and attention today, and enjoy the rest of your nice sunny day. It's nice out there. All righty, and we'll see you guys on Friday. Thank you. All right, we're gonna leave all this up.